We'll just proceed with the meeting. You're hereby summoned to attend the monthly meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Strabane, on Thursday, the 16th of April 2026 at 4 p.m. So we move just to take in the attendance. Alderman Cook, Alderman McMorris, Alderman Montgomery is running late, Councillor Lillian Barr, Councillor Raymond Barr,
Online, Karen.
Councillor Boggs,
And Shaw, Karen.
Councillor Clark,
And Shaw.
Councillor Devine, Councillor Duffy.
Apologise for Councillor Devine, and I'm here.
Okay, thank you. Councillor Hutton,
And Shaw.
Councillor McDade, Councillor McGowan, Councillor O'Farrell, and Councillor Tierney.
Here, Karen.
Okay, thank you, members.
Thank you, Karen. I'll read the broadcasting statement. I would like to remind everyone present at this meeting in the chamber or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website. So members, this is agenda item 4, declaration of members' interests. We can declare some declarations of interest now, or we can do it as the meeting progresses. Okay, thank you. And agenda item 5 is a deputation. So today we're going to receive a presentation on the regional capitation formula. And here present in the chamber today with us is Bridget Worth, who is the Director of Finance on the Strategic Planning and Performance Group. We also welcome Anne Brownlee, who's the Assistant Director of Finance on the Strategic Planning and Performance Group. We also have Kieran Taggart, who's the Principal Statistician, Project Support Analysis Branch, Information and Analysis Directorate. And finally, we have Ian Waugh, who's the Deputy Principal Statistician, Project Support Analysis Branch, Information and Analysis Directorate. You're all very, very welcome here today at the Health and Communities Committee. We will have your presentation in the first instance, and then we will open it up to the floor for some questions and observations from the members. We usually allow 10 minutes for the presentation, but because of the importance of the information that you're going to be relaying to the members today, and because we'd asked for this particular deputation, we will waive that 10-minute presentation time, so it'll allow you to get all the information across. James, the IT person, is at the back, so he will assist you with your slides, and if you just say next slide, James, he will move it along. So it's over to yourselves, and thank you very much for coming along.
So good afternoon. My name is Kieran Taggart, statistician working in the Department of Health. Here today to provide an outline of the formula used for allocating health resources across the 5 local commissioning groups. It's a complex area and may just take a few moments longer than to fully cover. So next slide, just. So just a bit of background. The regional capitation formula was first introduced in 1994. It is the way in which the department determines the target fair shares of available resources for each local commissioning group based on the makeup and needs of their population. The approach to the regional capitation formula for Northern Ireland is broadly similar to each of the other UK jurisdictions, with all the work in the Northern Ireland formula being peer reviewed by academics from outside of the department. So next slide, sorry. So the capitation formula itself is based on the 9 programmes of care in Northern Ireland, and these are listed on the slide. However, we have kept 10 separate models in the capitation formula, as the acute services are split into elective and non-elective. So essentially, we have a separate formula for each programme of care with 2 for acute services. Next slide, please. So the model for each programme of care is based on 3 elements. So the first element is the relevant population. And this refers to the client group on which the programme of care is based. So for example, the elderly programme of care will include all persons aged 65 and over. And when developing the model, NISRA census data is used to provide a base population. And then when we're maintaining and updating the formula each year, we base it on the civilian NISRA mid-year population estimates along with cross-border workers who are entitled to healthcare. The second element used is the age-gender weighting. As populations of a similar size generally have different levels of need for services due to their differing age and gender distributions, each programme of care model has its own distribution of age weights dependent on the types of services. The final formula element is the additional needs-based weighting. And this weighting is applied to account for variations of relative need for healthcare between persons of the same age due to differing life circumstances. And these factors are specific to each programme of care and are derived through a statistical modelling process. This statistical modelling process is used to find the factors that best explain the variation in use and are generally measures of deprivation or related to prevailing morbidity or mortality within the specific area in which the person is from. Recent examples from a non-elective acute model review were the health deprivation and disability scores, proportion of the population living in households whose equivalised income is below 60% of the Northern Ireland median, standard mortality ratio, urban-rural super output area, and the percentage of care home residents. It should also be noted that the modelling process for each programme of care goes through several stages before a final model is chosen. And these stages can include policy and supply, replication of the current model using equivalent variables, full needs model using stepwise backwards forwards regression, and then the guided model, which uses the variables which were significant in the regression, where we aim to reduce the number of retained variables to a smaller manageable number. So in essence, the simplest model that explains the maximum variance. And each programme of care models are then scaled and combined based on the relative planned spend for the following year. And over the next few slides, I will take you through each step of the process and show you how each of the elements impacts on the fair share allocation. So the next slide there, please. Apologies, the slides seem very, very small and you can't see them even. So you'll just have to trust what I'm saying. Or you can see them in front of you. I'm just looking at the screen there. So looking at the relevant population, we can see that the latest figures in our annual update of the computation formula, which used the 2023 civilian mid-year population estimates with cross-border workers, shows that the Western locality, the LCG, had the smallest population of the 5 LCGs. If we were to distribute the available resources based on population alone, the Western LCG would receive a share of 15.82% of available resources. Additionally, it should be noted that figures suggest the population share of the Western LCG has declined over the last 5 years from 16.11% in 2019 to 15.82% in 2023. Next slide, please. So the second element used for each model is an age-gender weighting. On the previous slide, I mentioned that the demographic composition of the population within each LCG will have an impact on the weighting of available resources. Populations of a similar size generally have different levels of need for services depending on due to their differing age and gender distribution. Each of the programme of care models has its own distribution of ages, weights, depending on the service that are offered. So for example, programme of care 4 in elderly care relates to the population aged 65 and over, who tend to require significantly more resources. This is illustrated in the age cost curve on the slide. This is based for the combined programs of care. So on it, we can see that in the chart on the left hand side there, we can see that from the age of about 60, the population steadily decreases, whilst costs for the older age group increase. And if we look at those aged 85 and over, we can see that the average cost per head is around £12,000. And that's more than 12 times those aged 20 to 24, which is around £1,600. So we can therefore say that areas with an older population will require more resources to meet their need. The table on the right-hand side of the slide shows that the Western LCG has a similar proportion of its population who are aged 65 and over as the Northern Ireland average, but a below average proportion for those aged 75 and over. In comparison, both the Northern and Southeastern LCGs have older populations, as they have higher proportions of their population aged 65 and over and 75 and over compared to Northern Ireland averages. Next slide, please. So on this slide, it illustrates the impact that the age gender weighting has on the fair shares compared with using the crude population. So the crude population is the dark blue and the age gender weighting is the lighter blue shading on the right. It shows that the areas with the older populations, the Northern and Southeastern LCGs, increase from this element of the model, whilst there are decreases in the Belfast, Southern and Western LCGs. It should be noted, however, that the decrease in the Western LCG share, about 0.21%, is smaller than those in either Belfast and the Southeastern Trust, reflecting its population composition. Next slide, please. So the third element taken into account is the additional needs weightings, and these are applied to the model to account for the variation of relative need for healthcare between persons of similar age due to different life circumstances. These additional needs are specific to each programme of care and derived from the statistical modelling process that I described earlier. These factors are generally measures of deprivation and are related to morbidity and mortality within the specific area in which the person lives. Could you show the map, please? So the map in view is based on the combined programs of care models and shows areas of greatest additional need highlighted in the darker colours, with lighter colours reflecting areas of less need. So I think if that's the interactive, if you want to zoom in there on around, right, you can see there, I think it's in Strabane and in Derry, there are pockets there of where there's super output areas that are showing high levels of need. And then the only other areas that you can see that have the same comparative levels would be in and around Belfast. So it's really your urban area. So back to the presentation, sorry. So the effect of using additional needs weighting on the overall shares is shown. Oh, sorry, I should have said next slide. So the effect of using additional needs weighting on the overall shares is shown in the graph on this slide. So we got, what's that slide? Slide 8. The one before that. Yeah. So from this, we can see that the Belfast, Southern and Western LCGs increase based on this adjustment, with the share for the Western LCG moving from 15.61% to 16.76%. So next slide, please. So in addition to the elements outlined in the previous slide, two additional cost adjustments are included in the formula, and these are rurality and economies of scale. So for rurality, I can say it right, the cost of delivering services is likely to be affected by the rurality of an area. The current formula indicates an adjustment for this rurality effect and is based upon the additional travel carried out by staff to provide selected community services in each area. The impact of this additional travel cost is considered in terms of the staff time and travel costs, with areas compensated for additional travel over the Northern Ireland average. For economies of scale, the adjustment is used to identify and quantify any scale effects that were present in hospital and community services in Northern Ireland, so that the relevant scale costs for service providers of different sizes could be estimated. This adjustment attempts to compensate LCGs for having hospitals or community services that are of a size that do not promote optimal unit costs. So for example, facilities of a smaller size will have pressures on achieving an optimal unit cost for their services, as they do not have a large patient client numbers over which to apportion their indirect and overheads. So expenditure data is used to uplift the rurality and economies of scale budget on a service by service basis to bring it in line with current expenditure levels. This increases the total pot in line with the annual increase in investment of the services with a rurality or economies of scale component. Go to the next slide, please. So looking at all the impact of adding in these final adjustments to the model, we can see that compared with the age, gender and additional needs adjustments, the effect of rurality and economies of scale are relatively minor. For the Western LCG, we can see a small increase in its allocation. So overall, if we compare the final shares with the starting point of the crude population, the Western LCG sees an increase of 1.02% in its fair share, from 15.82% to 16.84%. And the main driver of this increase is when we add in the additional needs weightings to the model. So thanks very much.
And then if you could just move on to the next slide, please. I suppose the final bit of the presentation was just to say a little bit about how the model translates into the allocations that we would actually provide to a trust. And I suppose the first thing to say is that, importantly, the capitation applies to the local population. It doesn't necessarily apply to the trust itself, because we may have instances, particularly in border areas, where the population of the trust will actually be served by the health services in another trust. So we're talking here about the fair share for that locality, which doesn't always translate directly into a trust. And indeed, where services are provided regionally, we obviously have to take some of those out of the model to make sure that those services are funded adequately in whichever trust is providing that regional service. So at the end of the day, we use capitation as an indication of whether a particular trust has got the right relative amount of funding. And we do look at other factors when we're actually doing allocations. So for example, if there's been capital development, there can often need to be additional investment in a trust area to ensure that that new facility is able to operate and its operating costs are met. We will sometimes base allocations on the actual estimated costs. That's particularly true of things like pay increases. We will look at actually the staff base of a particular organisation and make allocations in line with that. And similarly, in terms of general inflation allocations, will generally apply to the underlying cost base. But we'll then sense check that with the underlying capitation to try as far as we're able to keep it in line. Also, I think another particularly important point at the moment, we've heard today from the executive around the difficulties that we're facing in terms of the Northern Ireland budget overall, and that obviously translates into the amount of money available for health services. And you know, the capitation formula and the allocations we give can only allocate the funding we've got. And even if we are allocating a population exactly its relative share of funding, if that funding in totality is not adequate to meet need, then the capitation share will not be adequate to meet need. So capitation in itself can't compensate for wider funding constraints in terms of meeting need. I suppose it can only really ensure that we're meeting or not meeting need in an equitable way across the whole region. So that's just a sort of translation of capitation into how we work in practice. But we'd be happy to take any questions you might have on any aspect of that.
Thank you all very much. Is that the end of your presentation? Yeah, there's nobody else presenting.
Yes, thank you.
No, that's lovely. Thank you so much. And it was a lot of detail and some information that I suppose will help us form our views, and there'll be opinions and questions from the floor. But I suppose what I took from it is that the capitation is a mechanism. It's not a complete solution, because we still have serious issues with health inequalities across our city and district. And there's a lot of factors that can sort of help with that. And it's the partnership working, funding, being more available, I suppose staff capacity and stuff like that. But I'll let the floor, there'll be a few members that'll have a few questions for you. But thanks very much for that presentation. And I'll open it now to members. And the first indicated speaker is Councillor Duffy.
Thank you, Chair, and thank you to all of you for attending today, and thank you for the presentation. And there is an awful lot of detail and an awful lot of behind the scenes detail in terms of trying to just try and get your head around the formula, how it's brought together, and then the impact that it would have. I mean, it is clear from listening to you that the system does recognise that there is inequalities within the system, and then the formula looks at how that we can try and address those. And it does take into account in terms of deprivation, poor health outcomes, mortality rates, and then the added cost of delivering services in rural areas. And this trust area, or this council area, certainly has its fair share of rural areas. When you apply it to the Western Trust, and particularly Derry in the Northwest, you can see that we have a greater level of need when you look at the formula and everything else. We talk about the health inequalities that we face here in this city and district, and when you showed the map, you can certainly see that in terms of the super output areas and the levels of deprivation that we have in particular wards around our council area, and then how that impacts on people's health in terms of poor housing, poor mental health, and per maybe addiction services and all the rest of it. So it's all those services that need to be in the mix, and how that we can fund those adequately and how we can work it. The formula is doing its job in terms of the people here should be getting a better fair share. So probably a question that I had written down, and I'll try and get to that quickly, is it's a funding versus reality question. And if the funding shows that the Western Trust area has greater need, what is the current gap between what we actually get in terms of that fair share model and what we actually need, or what is being shown in the formula? Is there a gap in relation to that? Because I think what we can see very clearly is we know the issues, and the chair has outlined them in terms of what we've been trying to do around the community and voluntary sector as well, and trying to plug some of those gaps. But we very clearly can see that there is health inequalities in this area. We are struggling in terms of our waiting lists for addiction services, for mental health services, and for A&E department, all those things. So how are we trying to close that gap between what our need is and what the formula is showing that we actually need? Because I think that there's a lot. I'm sorry, I know you've tried to answer me twice, so I'll stop talking and let you answer.
No, you're fine. And I suppose the the work that we've done at the moment shows that the allocation that, I mean, again, you can't conflate locality with trust, but the work we've done would suggest that the trust is broadly in line with the allocation that it should be getting based on fair share. That's not to say, as I said at the end of my part of the presentation, that's not to say that it's getting what it needs. Because, as I said, when you've got a scenario where there isn't sufficient funding to meet need across the whole of the system, even where a population's getting its fair share, you will still see a gap between service delivery and need. So it's not in the case of the Western Trust that the fair share isn't being received. It's more about the underlying shortfall in funding for the service as a whole across the region as a whole.
Thanks, Sandra. Thank you. Any other indicated speakers? Councillor Harkin online. Sean, are you there online? You've indicated to speak. Okay. Councillor Harkin isn't responding online. Councillor Boggs, Councillor Tierney, and then we have Councillor Boggs and Alderman.
Thank you, Chair, and thank you all very much for your attendance. And I think it was very useful getting the graphs beforehand. I'm not sure I fully got my head around them, but at least having sight of them in advance was very useful. And I want to sort of try and follow on from Councillor Duffy's question, because although what I'm taking out of it is what you're presenting is saying that in terms of the model, we are getting, the Western Trust are getting our fair share, although the services, we're not getting what it costs to deliver all of the services. So as we know, there's going to be no more funding coming. The cost of running those services is going to increase year on year. So has this model been projected, for example, over the next 5 years, 10 years, and possibly further, to see what the deficit may be then? Because whilst the system may be saying that we're having a fair share now, it's in the years coming that I believe that system might not still relate the same way that it is now. Thank you.
Okay, and so it is about the model showing what percentage of the whole budget for Northern Ireland would be fair for the Western Trust to get. The problem is when the entire budget doesn't meet need. So it's still back to that issue of the global budget. Now, we're doing a lot of work in the department at the moment, as I'm sure you wouldn't be surprised to hear, around the impact of the 26-27 budget and what that might have on the department. It's clear from that, I suppose, that we still face a lot of challenges in terms of delivering our services, given the amount of funding that's likely to be available to us. And I mean, it's still early days in our working through those plans, but we are looking to see how we can make increased efficiencies in the way that we deliver our services in order to maximise what we're able to deliver within the funding that we've got. And we will also have to consider how we might change how services are delivered, potentially, in order to live within our means. But it's a very difficult problem for us at the moment, where we are running, this level of spending is running in excess of the amount that we're expecting to be allocated. And we're not yet at the point where there's an obvious solution to that.
Thank you very much. Councillor Boggs.
Gormaga Chair, and again, thank you all for coming on to see us today. I suppose it's a pretty bleak outlook in terms of, and I say that in the best possible way, you know, you're only dealing with what you are dealt with, but it is bleak to say the very least, because what I took, and correct me if I'm wrong, is under the fair share arrangement and how it is allocated, we are getting what we are entitled to, but not what we need, I think is what was said. But even, and I'm going to try and be a bit more optimistic, and I'm not saying Councillor Tierney was being intentionally pessimistic, it may be unlikely that additional funding that is needed comes, but in the scenario where it did, and I know the executive are united today in the approach that the British government need to step up and provide more, and we welcome that. If Keir Starmer were to listen and provide additional funding in future years for this place, and we were funded at need rather than what we are at the minute, is it the case that an increased budget in future years could only cover then a standstill position, basically, of what trusts are allowed, or not allowed isn't the right word, what trusts can provide? So, you know, where you may get increased funding, it is going to cost more to deliver the services the trusts deliver today in 5, 6, 7 years. So really, in that case, then additional funding does not equate to additional service. It merely equates to still providing the level of service that we are entitled to, but not the service that we need. And that is not the fault of the formula or of yourselves or even of whoever the health minister is of the day and the amount of money that they allocate out to trusts. It's merely the reality that we are in a position where our health service is not fit for purpose. I'm not going to ask you to give a view unless you want to. My view is very clear. We need to move beyond the current health service that we have. It does not work. Experts tell us that we have a perfect size population on this island to run one national Irish health service, rather than 5 trusts across the north, plus a different health service in the 26. You know, we have people coming from Dublin to Ballykelly to get procedures that are funded by the Irish government. We have people from Belfast going to Kerry or Cork to get private care down there that is then funded by a public service up here. I mean, it is completely ridiculous to actually say that we are, we can't provide the care here for people who reside in the north as it is at the minute, but we can send them down south, and where care can't be provided down south, we'll send them up north. No, what we need, and it is purely, I suppose, a constitutional argument, which I am sure you're not going to want to get into the realms of, but it has to be made for those that are listening in. There is a solution to how we address the ridiculous situation we're in at the moment with our health service, and in our view, and I'm glad the seating arrangement put Councillor Tierney beside me, not Alderman Hussey at this point, but our view would be that is under a new health service rather than where we are. So I suppose to get back to the question that I have for you, increased funding does not necessarily mean increased services for people that we represent, and therefore does not lead to an improvement on the health inequalities that the chair has talked about, or the level of service for addiction and mental health that Councillor Duffy has alluded to also. So it's just a question of that, of how do we break the cycle of increased funding only covering the service that we currently have at the minute, if I've portrayed that properly.
Yeah, no, I understand your point. Yes, so I suppose flippantly, I would say, well, it depends how much additional funding, because clearly if we got a whole bucket load of additional funding, we're over and above the funding gap, we would actually be able to see that. But realistically, that there isn't much prospect of us getting, we're struggling to make the argument for what we believe we absolutely need. So that point is true, I think. And, the policy areas aren't my area of expertise, but, the Minister has set out a reset plan, and he is looking at an increasing use of a neighbourhood model. And those are the sorts of things where we are looking to see how we can change the way we deliver care to make it better for people. Because a really fortunate thing that we see in healthcare is that actually when you deliver care in a better way, it actually often is also more cost effective. So it's not usually a choice between what's the best way of doing it and what's the least expensive. often the neighbourhood type pathway that's closer to people's homes where that can be delivered is often more cost effective than going to an acute hospital. So if we can make that shift, and if we can find a way of investing more at the early stages of people's conditions and helping to keep them out of hospital where they don't want to be. I mean, I can't think of anybody who's going to say, I really wish I could spend a significant proportion of my life in a hospital. Coincidentally, unfortunately for the budget, it's more cost effective for them not to be in an acute hospital. So that's the sort of change that we need to try and look at. It's very difficult to make that change while we're also having to manage a financial crisis. So, and maybe I don't know that crisis is too strong a word for it, to be honest with you. So, you know, it's hard. If it was easy, we would have done it already. But there is a map out there as to how we might try to make things better. I'll leave the constitutional question to yourselves.
That's not, are you okay for me to come back in just for a brief point, Chair? I suppose the other thing that I will say, and either inside or outside of a different constitutional position, you know, if Donegal was to join the Western Trust tomorrow, I suppose is the line that I'm going down. If we were to rewrite, you know, you would be able to have a better spread, I suppose, of service here in the Northwest in particular. What I'm asking then is where we at times ask constituents to come with us on, you know, the journey of transformation among the health service, that not every, you know, hospital setting is going to provide X, Y, and Z, you know, that you may need to travel a bit further, but that you will get your care in a quicker and more efficient manner. And that is a task at times, particularly in the rural constituency that myself and Alderman Hussey, you know, that setting would represent. It can be difficult to ask somebody to travel, you know, to Belfast when they see that Derry or Enniskillen is already far enough away, but it may not be the case that we can provide all things. In terms of this funding situation or the mechanism in relation to how trusts are funded, how then, if it is, I suppose, more unlikely in a situation where trusts with a more rural makeup, in terms of the Western Trust as an example, is additional funding therefore meaning that the Belfast Trust may get more funding? You know, how does that work out in terms of the trust still receive a fair amount of funding, but that all regional services aren't put into more urban trusts and then rural ones lose out? Does that mean then, you know, hypothetically, could trusts with a more rural background then be funded less? So therefore there is kind of a vicious cycle that people then do have to travel more and more because we are regionalising those services, so therefore those trusts get more money, so therefore more services are then put on those trusts. Or how do we break the cycle to make sure that somebody in Belfast can equally travel to Derry to get something done out in Galvin, rather than, you know, the regionalisation of the health service being regionalised too much to one kind of epicentre within the north, rather than it being spread out across all 5 trusts, if I've kind of...
And I can't give you a full answer to that question because, again, it's straying a little bit outside my area of expertise. But I mean, I know that certainly the former health minister, Minister Swan, would have been quoted as saying that we need every square foot of our health state. So I think the point you make is a fair one. Regionalisation doesn't necessarily mean move it to Belfast. There's sometimes when practicalities have meant that that's been the case, but I think certainly my sense of the conversations in the department are that, yeah, regionalisation doesn't necessarily mean move it to Belfast.
Thank you, Alderman Hussey.
Thank you, Chair, and thank you very much for the presentation. Totally agree with Councillor Boggs that there should be one trust within Northern Ireland. A trust that has a mutual cooperation agreement with the whatever system may exist within the Republic of Ireland. From your perspective, what we've heard, I presume, is a macro case apportionment of an insufficient budget. Basically, that's what we've heard. And on that macro level, you have said this is what the Western Trust entitled to. Does the same process take place within the trusts? And I asked for that map to be brought up again because you'll notice on the left-hand side, there's a large rural area, which I happen to represent, which is also one of those darker areas. So is there an incumbency on the Western Trust to ensure that their distribution also reflects the needs to whatever extent they are able to reflect those needs in those areas throughout their trust? And we know that the boundaries of the trust aren't there, but we know what they are. So there's that question. Then the point has already been made about regionalisation. For example, you can go into Altnagalvin, meet a nurse practitioner with regard to a vascular issue, but that nurse practitioner will then have to put you through to the Belfast Trust for surgery contact. And I've actually looked it up, and it's 99 weeks waiting list in the Belfast Trust for a vascular issue. I've looked through some of the others, and they're not far off it, right the way across. That's for routine. When that happens, do the Western Trust pay the Belfast Trust for the treatment of that client that goes to Belfast? And my final point, there are issues that have been highlighted. Mental health is one. And you have the issue at Omagh, where improved mental health facilities were promised within the Omagh Enhanced Hospital, which didn't materialise. Is that down to trust, or is that down to the Northern Ireland Health Department? And I said at the beginning, an insufficient budget, but that's historic. I well remember going back to Michael Majibs's time, and his big complaint was, we haven't got enough money. And people were laughing at him then. They're not laughing at anybody now who's suggesting that health needs more money.
Thank you, Alderman Hussey.
Okay, I'll do my best on that, and do, you know, bring me back if I miss a bit. There may be bits that I'm not able to answer. And to be honest with you, the issue of what the Western Trust does and how it allocates its funding would largely be a matter for the Western Trust. In terms of the...
Sorry, just on the back of that, would they be expected to follow a similar process at the micro level to what you do at the macro level?
I mean, I suppose I don't know that there's any requirement for them to do that, but I would be surprised if they aren't cognizant of inequalities when they are trying to allocate their services, and I would be surprised if they're not cognizant of need. But I obviously can't answer for the trust, but they will be aware of those issues. So it would surprise me if it's not part of their process. But as I say, I can't answer for them. In terms of the scenario that you described where somebody's going to Belfast, I can't hand on heart say this is definitely true for the particular service that you've mentioned without a bit of research. But if it's a regional service that Belfast is delivering on behalf of the region, then they will have separate funding going directly to the Belfast Trust to run that regional service. And that will be in addition to the funding that they have to serve the Belfast locality. So again, for a regional service, the funding will go directly to Belfast. Then the secondary part of that is where the comment I made at the start about it's a funding for a locality, not for a trust. So if we have a history of a lot of people from the Western Trust having to travel for Belfast for services, then that would be a reason why the Belfast Trust might have slightly more than its fair share of allocation, than if they simply had the allocation for the Belfast locality, if that makes sense. So that's the reason why the Belfast Trust may have more funding than the Belfast locality, which is why there isn't a direct correlation between them. Have I missed any other parts of what you were asking? Yeah. Okay, thank you.
Thanks very much. And I just have one last question just before we finish up. And I suppose whenever we look at the health inequalities report and we break it down into older people are getting frailer, sick people are getting sicker, communities are becoming more disadvantaged. Can I just ask how you use the formula to invest earlier, to sort of get into that early intervention prevention model? Because I know it's based on the need within that community, but is there any early investment in prevention?
So I don't think, and Kieran will correct me if I'm wrong, I don't think there's any particular focus in the model there. But again, back to the comment I made to Councillor Boggs, I think what we would like to see is that if we can move funding to that earlier intervention, it is more cost effective. But what we struggle with at the moment when you don't have additional investment is we're spending a lot of money addressing the need, the acute need when it presents, because that's the need that's doing the harm right now. And we're not then having the funding and the capability of trying to address it downstream, where smaller investment would prevent us from having to spend the larger amount of money later. And it's a very, very difficult thing to do because, you know, our whole system is set up to deal with the person who has a need now. They're here right now and they have a need. And you know, to say, well, sorry, no, we're not going to meet that need because actually we're going to spend money on somebody whose need is less acute so that it doesn't become acute in the future. It's very difficult. We try not to take, you know, we try not to focus solely on the acute at the expense of the prevention. But that is the real challenge for us at the moment, is how do you shift the funding downstream without you know, the severe detriment it could do to the people who have a need today.
No, I totally understand it, but it's like everybody who is unwell, and if they go back into their community to be cared for, they stay well for longer, they've less hospital visits, and I suppose it all comes down to that education piece as well that the community and voluntary sector would be involved in, and hopefully the neighbourhood model is something that will stick around for a while, because when you look at the strategic or the social return of investment figures for people being cared for within their community, it is saving millions of pounds. So it is something that would be worth looking at and keeping it on the radar, the whole prevention model. But if there's nobody else with, it's Councillor Duffy.
I'm going to finish off with a really depressing note. Sorry. But I really do. I'm really grateful for you coming in and presenting that information today, because I think it was really important for us to have that information and to try and have an understanding of the funding, how it's decided and where it goes and all the rest of it. So it's important that we have that. But what came to my mind there when you were talking was it's nearly like moving the deck chairs on the Titanic. The system, our health system, is broken. We have been underfunded for decades from the British government. We see no scale of that changing in any significant way. So at this stage, what we're trying to do with this formula is plug gaps and try our best to keep people alive, which is not a health service in my view. And as Councillor Boggs has outlined, and I know you can't comment on it, but I think the only thing that we can do in terms of trying to hope for a health service that actually meets the needs of all our population is to look at constitutional change and an all Ireland health system that actually works for everyone. And I can see Councillor Hussey. I thought he was actually nodding in agreement there, but but I may be wrong. But I honestly, I thank you for coming in, but you have really endorsed my already view that the health system that we have at the minute is not able to be fixed under the current circumstances. And I think that we need to be looking ahead at an All Ireland free at the point of delivery health service. But thank you.
As I say, I'll leave the constitutional question to you guys, but I mean, we are doing everything we can to make it work. And, you know, I wouldn't want people to go away from here with the sense that there isn't any hope. You know, there are things that we can do that will make a change, and you know, we are still seeing waiting lists coming down. So things, you know, there are glimmers of hope in there, but yeah, it's tough at the moment. It is.
Thank you very much. And as stark as it is, we need to know. We need to have this information because we are elected representatives and our job is to represent people. So sometimes people come in here and give us deputations and we are all singing and dancing. Sometimes it gives us a job of work. So on that note, thank you so much because it was very informative. Mightn't be what we wanted to hear, but it's something that we can look at and take back and talk about as parties and as representatives. So you were all very welcome here today. You're very welcome to stay for the rest of the meeting if you would like. So Bridget, Anne, Kieran and Ian, thank you so much. And we'll see you again, hopefully, back in the chamber with maybe a bit better news. Thank you so much. Safe home.
You're working for the HSE doing South Astro United.
So members, we'll continue on with the rest of the meeting. He's okay? Don't think we need a break. No, we're grand. And we'll just record, we've received a message. Councillor McDade has sent her apologies. Karen, you can record that. So members, the next agenda item is chairperson's business. I just have a short item to speak on, and that is to welcome Zara, our council employee who is going to be the new note taker here in the Health and Communities Committee. So Sarah, you're very, very welcome, and I'm going to warn each and every one of them to go slow, take their time. You're still in a training program, and if anybody has any proposals going forward, please get them in beforehand so Sarah doesn't get into a panic down there in her new role. But you're very welcome, Sarah, and we're all looking forward to working with you, and we're here to help. Anything you need, let us know. Is that okay? And the second item is Councillor Boggs.
Dermot, Chair, and thank you for letting me in late on this. And members will obviously know that an announcement was only made this afternoon in relation to some level of support coming from the executive today in relation to the rising cost of living. And we spoke about it at committee yesterday in relation for the need for more to be done. I don't think anybody is under the illusion that it goes far enough. I think the executive collectively themselves recognise that they would like to do more, but under the current financial situation, that is not possible. And they have been honest with that, and I think the public deserve honesty at the minute in relation to what can be done and what can't be done. Yesterday and here we had a very clear signal from the Environment and Regeneration Committee that the British government still need to step up and do more. And I reiterate the comments yesterday that while Keir Starmer could have taken the opportunity to announce a package of measures to support people, particularly here in the north, he instead took the opportunity to pat himself on the back in relation to increased spending on his defence and militarisation agenda. So that shows you where the British government's priorities are at. For our part here, for the executive's part here, they have now agreed a package. I welcome it. But I also want to just reiterate and I suppose agree with the comments of the First Minister that the executive's budget is a breaking point. And the British government, who we have just discussed with health professionals, the British government need to wake up to the picture here that we are funded well below what we are needed. We are not asking for special treatment. We are not asking to be treated any differently to anybody else. What we are asking for is to be funded at need, so that the executive could maybe step up and do more, because I think that is what they are willing to step up and do more, but they do not have the financial backing. So I think from this committee today, it is really important, as a committee that has responsibility for our communities and for the health and well-being of the people that we represent, that we send a clear message again today that the British government need to step up to the plate, but that we do welcome some progress being made in relation to the support package that is going out to those in most need, and also welcome the comments from ministers that where they can go further, they will, but they do need the financial backing. And I suppose it's not so much a proposal, so I haven't sent it on, but when those details become available and information is circulated, I think NI Direct is the mechanism that information is going to come out, that it is publicised across our council platforms, so that those who are most in need know that there is some support available, how they access that, and to make sure it gets to the people that need it most. But the bottom line is the British government need to do more, and we need to see them act swiftly to support workers, families and communities here in the north. Thanks, Chair.
Thank you very much, Councillor Boggs. And we have Alderman Kerrigan online.
Thank you very much, Chair, for allowing me in. Apologies, I'm not a member of committee, but just in a way to concur with the comments there from Councillor Boggs there. It's not as much money as we would like, but I do note between the money, the 17 million that came from Westminster and an excess of 19 million that the Stormont executive had been able to come together with, with the potential of 340,000 households. And I know £100 is not a large sum of money, but it shows that the executive is trying to do something. But again, it would be nice to get additional monies in there. As I say, the budgets are stretched, and I do concur in that comment with Councillor Boggs there in relation to it, because we know every department is suffering there in regards to Stormont, in regards to how tight the budgets are, and they have done. I'm not going to say they've done well, but they've worked well together to realise this 19 million, which they've been able to put towards it. And as I say, we're coming into a figure there, which have been mentioned there, in the region of £30,000 of a household income. So you're getting into that, what would have been referred to as the working poor, and that's always a section of community that misses out. And oftentimes we will all have heard that from individuals whereby maybe two individuals are working, or one's working, one member of households working, or one's working part-time or whatever, and they're saying there's nothing for us out there. There's no benefit, or there's no money coming towards us to help us, and we're struggling. So there's something. It's a token gesture, but I do welcome it, and I see it's coming through Department for Communities and Munster Lions will be the one facilitating it. So hopefully we can get a bit of movement as to when. I do see, note there's no time frame just yet, but hopefully that can be got out as soon as possible. But to concur with the comments and thank Councillor Boggs for raising it. Thank you, Chair, for allowing me in.
Thank you, Alderman Kerrigan. And the next indicated speaker online is Councillor Harkin.
Discuss the announcement coming from Stormont about 100.
Hi, Sean, we couldn't hear you there. You wouldn't start again, please.
Yeah, thank you, Chair. I just says thank you for letting me in. I'm not a member of this committee, but I'll definitely take the opportunity to comment on the announcement that came from Stormont today about what will be £100 for families or households at some point this year. And look, I think that people will welcome any kind of help, but when you look at the increase in energy costs, it really is a drop in the ocean, and that's the first thing that can be acknowledged, and it's not going to help people right now. And look, we have called as a council already on Stormont and on Westminster to actually do more direct things like for example, cap prices. There should be a cap at the petrol pump right now on the cost of the price of diesel and petrol, and that will have an immediate impact in terms of helping people. So there's still a real reluctance from government, Westminster very much so, and from Stormont to take action that would actually challenge the way that the market works. because what we end up doing here is this ends up being a subsidy back to the very energy companies that are price gouging and profiteering right now. The other thing to say is that though, whether it is Stormont or the Dáil, I mean, we're only getting this action because people went out and been disruptive and taken action. And a lot of times protest is dismissed as not mattering. But when you look at the South, I mean, the package that came about in the South happened because people went out and blocked streets, blocked oil refineries and protested and did it in a very disruptive way. And that's what delivered that's what forced the Irish government to actually deliver a much bigger package of support that still doesn't go far enough. But it's similar with Stormont. I mean, it took protests this week. They actually caused disruption that prompted Stormont into action. So look, there's a lesson for everybody else in this. If you want action, if you want something done, we can go to our representatives. But the type of direct action that we've seen over the last week and a half is far more effective in bringing about change. So look, I think that it is. I think that this is why we've had the communities minister scrambling today to come up with some sort of plan. It doesn't go far enough. It isn't going to help people right now. And we need to see a lot more being done. Thank you, Chair.
Thank you, Councillor Harkin. And Councillor Boggs, you're looking to come back in there.
Just very quickly, I don't disagree with a lot of what Councillor Harkin has says, but I think to try and conflict fuel protests this week and last week with an announcement on support for home heating oil is completely disingenuous. Ministers from the executive, alongside representatives of this council and also our MLA representative of Stormont, have now been calling for some time for support. That support in relation to home heating oil has now come. Is it enough? Absolutely not. But ministers have worked, as Alderman Kerrigan says, have worked together to get out the door what they can. The fuel protest argument still stands. The British government need to cut excise duty on fuel. They have the power to do that, not the Stormont executive, not this council, the British government. So that fight continues. That message still needs to ring loud and clear back to the British government and to Starmer. Start supporting workers and families, cut the excise duty, reduce fuel at the pump, and allow workers and families to put money back into their own pockets. But to try and claim, as Councillor Harkin has done, that fuel protests have now all of a sudden caused the Communities Minister or anybody else to put together a package of supports for home heating oil is completely disingenuous. And I think I would ask him to stand with the rest of us, keep the fight on in relation to fuel costs, and demand that the British government act, because they're the only people that can.
Thank you, Councillor Boggs. Councillor Tierney.
Thank you, Chair. And thank you to Councillor Boggs for raising this. I too welcome the fact that there is an announcement today from the executive to offer support to people. I acknowledge, as I believe Councillor Boggs did, that it's not enough, but it's a start. And where we see progress, I think we should acknowledge that. So I have no issue in doing that. I was caught up in one of the fuel protests on Monday as I was trying to get to Belfast City Airport, and it's the first time that I've been in traffic where I didn't find myself becoming frustrated, because I could understand why they were there, and I agree that whatever mechanism needs to be in place to support families, to support businesses, and whoever can relieve that pressure needs to act, and they need to act pretty quickly. And it's shameful, in my opinion, that they haven't acted already. I spoke to a carer on Saturday afternoon who is a carer in the community, uses her car for work. And before this war started and before fuel prices went up, for this carer to fill her car up, to go to work, to look after some of the most vulnerable people across Derry and Strabane, it cost £60 to fill her car. 2 weeks ago, it was 90. That's an increase of £30 for someone to go to work to look after sick people. That £30 isn't going to be reimbursed because the mileage allowance from the company that she works for has not been increased. So that's £30 directly out of one person's wages. How many other carers, community nurses, and other people who work in our communities looking after people are now out that money because of a mad international regime in America? Because that's what's causing this the people here. So whether people want to fall out about who can relieve that pressure or not, the reality is that it's having an impact directly here on people. And I worry about how many carers that actually take the opinion and say, it's becoming too expensive for me to go to my work. How many then decide to look for a job elsewhere? And then what happens to the people that they're looking after? So this, whilst it may be an international issue, it's having a direct impact on our communities and can have a direct impact on vulnerable people in our communities. And that's what I'm most concerned about. I welcome the measures. I was actually glad to see that the executive went a step further, and as Alderman Kerrigan described them as the working poor, where they are now being taken in and being thought about, and measures being introduced to try and support them as well. And I think that's welcome too. So whatever we need to do here to try and get support to people, we absolutely should. And I am more than happy, and people may be surprised at this given that we're in opposition, but I'm more than happy to welcome the fact that the executive have come quickly to try and get money out, albeit not a lot, but money out to people. I welcome that. I know that the minister was very quick today to run to Nolan before the executive met to announce that this was possibly going to happen. I hope he's just quick to run and get this money out the door and into people's bank accounts who need it. Thank you, Chair, and thanks again to Councillor Boggs.
Thank you, Councillor Tierney. And Councillor Harkin, you want it back in there?
Yeah, look, I think that £100 is not going to make a big difference given the monthly bills or weekly bills that people are facing, and that very much includes cares. The reality is that home heating oil is not regulated, and that Stormont actually has the ability to regulate it. We passed a motion last March in this council calling on Stormont to introduce regulation for home heating oil, which would be price caps. I don't understand why they won't do it, because that would actually make a big difference. And the problem is that it sounds to me that Stormont wants to get a pat in the back for coming up with £100 that people won't receive for months, maybe into the autumn. And last month we were talking about the fact that Stormont MLAs had awarded themselves a 27% increase in their pay, which is absolutely astonishing. And now you look at the scale of help that people are getting, and it is a drop in the ocean. So I don't think we should be running around patting ministers on the back and telling and allowing the parties that are running Stormont and running the North into the ground, to be quite honest, after hearing that discussion about our health service, to now say we're doing our best. We're not doing our best. We could be taking actions like actually regulating home heating oil, which we know is a massive cost for people because of the overdependence that households here have with home heating oil. So that's one thing that we could be doing that we're not. And I think people can see through this.
Thank you, Councillor Harkin. Alderman Hussey.
Thank you, Chair, for the opportunity, and thank you to Councillor Boggs for bringing the subject through. I think one thing that pleased me when the announcement was made, this was an executive decision. So the ministers were able to sit around the table and pull this together. Now that can only be good in itself. The initial allowance that I heard being talked about was 50 quid. They've actually upped that to 100. But not alone that, they've expanded the remit of those who will be eligible to receive this. So well done to the executive on this in recognising the situation that exists. And as Alderman Kerrigan has referred to, there are that batch within what are called the working poor. And consideration has been given to that scenario. It's the tip of the iceberg of what's needed. But it's a start, as people are saying. It's a recognition that there is the need. We talked about need in the presentation. There is that need in the community. And an executive has got together to try and address an element of that need. And that in itself has to be welcomed. Thank you, Chair.
Thank you, Alderman Hussey. And final speaker, Councillor Tierney.
Thank you, Chair. And I just want to come back on something that Councillor Harkin referenced, and there's enough people in around the executive and even in around this chamber to defend the executive. That's not what I'm doing. What I think is what we should do, and we should be mature enough to recognise progress, and I do, and that's why I'm welcoming where that announcement came from today. I agree with Councillor Harkin when he says £100 is a drop in the ocean. But Chair, I give an example of how one person that I spoke to over the weekend was impacted by this. And whilst £100 is a drop in the ocean, it covers that increase for the best part of a month for that person. How many other families and people across this district does it cover? And who knows where we will be after that? There may be, who knows, there may be a further announcement from the executive. There may be a further announcement from the British government. But at the minute, there is a process there to cover that one extra worry that that one person had that I spoke to. I think that should be welcomed.
Thank you, Councillor Tierney. So we'll move on from chairperson's business, members, and we will go on to agenda item 7, which is matters arising from the open minutes of the Health and Community Committee held on Thursday, the 12th of March. Any matters arising? Councillor Clark.
Yeah, I just want to refer to HC 68/26, and I just want to thank Karen for her work on bringing to the fore the SCAIG task force. I welcome the introduction workshop, which is now planned for Thursday the 28th of May, and I've received my invitation and I will be going. So thank you very much, Karen.
Thank you, Councillor Clark. Any other matters arising? No. Agenda item 8, which is the Good Relations Action Plan and funding bid to the Executive Office, and that is Barry.
Thanks, Chair. Members, this is to seek your approval on the Good Relations Action Plan for 26-27, including the funding bid to the Executive Office. Members, you'll see in section 3 and 4, the total bid is £484,250 on the required contribution, which is in rates from Council. However, the TAO's open budget position for 26-27 has not been confirmed. Therefore, TAO has asked Council to submit a similar funding bid to that of last financial year. Members will be aware that the Good Relations team engaged the Rain McCourt consultant to undertake an audit of good relations in the council area in November 25, and that was completed in January 26. This audit is being finalised and the full report will be presented at a future meeting of this committee. Members of the Good Relations Working Group met in early March to discuss the bid that was going into TAO and have approved this subject to approval today at committee. So the recommendation is that members note the content of the report and approve the Good Relations Action Plan and funding bid to TAO for 2026-27.
Thank you, Barry. And Councillor Duffy.
Thank you, Chair, and Barry, thank you for the report and thank you for the information in it. And I'm just happy to approve it and send my thanks to the team for the work that has been carried out in relation to it. And that's it.
Thank you, Sandra. Moving on, members, agenda item 9, consensual action plans, and that's Barry again.
Thanks, Chair. Members, this is to update you on the consensual action plan submitted by the 8 local growth partnerships for the 26-27 year and to seek your approval to issue letters of offer to the lead groups listed in your Appendix B for the financial year. And members, just to note, most members will be aware of this process has been ongoing for a number of years, but we have expanded this process out to include the Community Support Fund, Good Relations funding, and the Ending Violence Against Women and Girls funding allocated across the 7 DAs in Strabane Town. Other council sections have also adopted the model, including the Police and Community Safety Partnership and more recently the Festival and Events team as well. So members, in terms of the recommendation, that members approve the issue of the letters of offer to the lead groups listed and that members approve the letters of offer for the associated management administration costs for each of the lead partners. Thank you, Chair. Thank
you, Barry. And Councillor Clark.
Yeah, and I'm happy to approve that as well. Sorry, but I want to draw our attention to 3.6, and it's I'm glad to see that Council has procured the services of Professor Mary Breen Smith to engage with the community and voluntary sectors in the rural DAs. Whilst we've been focusing all our attention on the 2 murders that occurred in our city in the same amount of years, and rightly so, I think it's very, very important that we don't forget those women and girls who are living in the rural communities who are also experiencing domestic violence. So I really welcome that. And also 4. Where am I? 4.3, and it's the delivery of the TEO funded ending violence against women and girls action plans, where there will be emphasis placed on strengthening collaboration with council and the women's sector. We can only welcome this. This is fantastic. We have fantastic support groups and women's groups in our communities, and I welcome the idea of helping to build capacity in these groups. These groups are at the coalface of our communities, and they're dealing with issues day in and day out, and they already have the hands-on support and expertise to offer these groups. So it makes sense to strengthen collaboration and to keep the model of ending violence against women and girls to the forefront of council and the rural communities. So thank you.
100% agree. Councillor Clark, thank you for that. And Councillor Tierney.
Thank you, Chair. I just want to declare an interest as a board member of the Greater Chantal Area Partnership, who's the lead partner in the Ballyrona area.
Duly noted. Councillor Tierney. Alderman Hussey.
Thank you, Chair, and thank you, Barry, for the report. Not a member of committee, but going back to the first committee meeting this week, Business and Culture, one of the areas that was identified, I'm not sure who else was there, was there's a gap between highlight funding or headline funding and consensual funding on the local community partnership boards. And I wonder, going forward, is that something that officers can look at? Two groups were identified who fell into that gap between the headline and the consensual funding. So is this what we have here? I welcome, but the overall process, can officers look at that with regard to future allocation of funding going into future financial years?
Certainly, I think I only briefly saw some coverage of the meeting, but we'll direct some conversation with the Business and Culture team around that. We've shared our approach to the consensual model, but absolutely, we'll take a collective look at it.
Thank you, Chair. Appreciate that.
Thank you. And we'll move on, members, to agenda item 10, which is the approval for community development programme areas and advice. And it's the programme updates of 3-month award, and that's Barry again.
Thank you, Chair. Members, this is to seek your approval of 3 months funding for the community development programme areas outlined in section 2.1. And members, again, similar to the last number of reports, the receipt of the letter from the Minister of Communities on the interim funding position for 26-27 will allow for the continued delivery of the key community development programmes up until the 30th of June 26. However, there's still uncertainty around budgets and allocations, and the absence of a letter of offer remains a concern and a challenge. So our awards are for up to that period of time, members. The purpose of and recommendation also is to give you an update on the outcome of the follow-up of the quality controlled audit on Craig Community Collective, who have achieved the Gold Award. And finally, to seek members' approval for the awarding of 38,926.47p to Advice Northwest for the Integrated Advice Partnership Fund for the financial year 26-27. Thank you, Chair.
Thank you, Barry. And first indicated speaker is Alderman Kerrigan online.
Yeah, you're all right, Chair. That was in relation to the consensual, but that's all right. I'll take it up with officers. Thank you.
Apologies, Alderman Kerrigan. Councillor Boggs.
Yeah, thank you, Chair. And I won't say I'm happy to propose the recommendation, because I would be happier if we were in the position where we had a multi-year budget and we weren't putting the community and voluntary sector and other sectors onto these 3-month periods. We had a conversation at the recent session with the local growth partnership in Strabane in relation to the ongoing review of neighbourhood renewal, and it was a very strong feature in relation to the fact that 3-month cycles of funding is not a sustainable position for anybody as an employee and as a human being to be in, but particularly not when these are the people that are the backbone of our communities who are providing services and violence against women and girls. Social supermarkets, our community-run organisations are always having a grey cloud of what is the next 3 months, and so therefore I'm not content with the recommendation, but we'll propose it to make sure that we continue on with funding for those groups. But I think it again highlights what we have talked about now on 2 items already in this committee, is the need for this place to be funded at need. When we can't get a multi-year budget over the line, although that is the focus of all ministers and the executive, it is because of the impact that it has on each of the departments. Nobody's happy. While I can only talk for our party, we want to get to a position where we have a multi-year budget. But it is very, very difficult when you're then looking at a multi-year budget with the background of not meeting the demands within departments, whether that be our own departments or particularly in this case, under the Department for Communities. We need to see a sustainable funding model going forward for people to ensure that our communities feel the benefit, but also that these people that are on and programs that are on 3-month notices receive the support that they need in order to plan better for the future. So in that regard, we'll propose the recommendation, but want to send our ongoing solidarity and support to those people who continue to face 3-month cycles in the jobs that they're doing, and make it very clear to them that we will continue to lobby the executive and our own ministers on it. But ultimately, again, and I hate to sound like I'm going with a begging bowl in every item that I talk to about, but the British government need to fund this place. It need, again, not special treatment, not over and above what we needed or what we deserve, but fund us at what we need so that we are not finding ourselves, in particular community and voluntary sector, in this position. It's like a hamster wheel at this stage, and I'm sure they feel it much more than we ever could, but want to send them our ongoing support, and that continues our fight, both as local councillors, but also I know our MLA and our ministerial team, in particular in our party, our fight continues to get to that position where we have a multi-year budget that addresses the issues that I've highlighted in relation to this item. Thanks, Chair.
Thank you, Councillor Boggs. Councillor Tierney.
Thank you, Chair. And I suppose similarly to Councillor Boggs, I'm not happy to propose this because the 3-month cycle, in my opinion, is cruel. It's cruel to people who don't know that in 3 months' time whether they're still going to be in a job or not. And I couldn't imagine the anxiety that not only the employee but their family face as they're going through that cycle. So whilst it's good to see the money going out and those services being allowed to continue, some type of better system to allow these to roll out properly and hit the need that they're supposed to would be much more welcome. I know Councillor Boggs said he doesn't want to go seem as if he's going with a begging bowl to the British government every time. They either fund us the way we need or they allow us to look at a different mechanism of funding. And I think that would be a far more interesting conversation. But I'm content, I suppose, to support the recommendation here today. I think 5.2 of the recommendation should be noted as well, because the quality control audit is quite difficult. And for Pregnant Community Collective, who, if we're going to be honest, aren't that long in existence, aren't doing advice that long in terms of the council processes and following that, to get a gold standard so early on, I think is a massive achievement for them. And I would like to congratulate them in getting that. And hopefully we will see some better formula in terms of the rollout of monies going forward. Thank you.
Thank you, Councillor Tierney. And Councillor Harkin online.
Thank you for letting me in, Chair. Yeah, similarly, look, the 3-month budget is unacceptable and is very frustrating for anyone or any organisation in receipt of it, and it's something we have to get away from as soon as possible. And in terms of like community and voluntary sector organisations, look, April 1st was a bad day for a lot of community and voluntary sector organisations across the north. That's when a massive 64% cut went through, and that the impact of that will work its way through. And this was something that Stormont did have the opportunity to do something about, to step in and make up the funding gap, but chose not to. So that will put services and jobs under massive pressure. We'll lose jobs, we'll lose services, but this is something Stormont could have done something about, but chose not to. I also wanted to join Councillor Tierney in welcoming the gold standard that Craig Community Collective received. And I would say, look, that it's not been a straightforward process for Craig and Community Collective. There was an attempt to undermine their achievement and force them to redo their pilot, even though they had met the standard that we called on them to meet, which I think was very, very unfair. And they've now demonstrated that they're more than capable and committed to delivering advice services. And I know it's a lot of work. Look, we know that all of our advice services have people there that work very, very hard. And we know that people in our district desperately need these services. So it's good to see an organisation that was undercut do so well and be able to meet the gold standard. And I want to commend them on that achievement. Thank you, Chair.
Thank you, Councillor Harkin. And the next indicated speaker is Alderman Hussey.
Thanks again for the opportunity, Chair, and totally agree with previous speakers about this constant situation that we find ourselves in of not having multi-year budgets. It goes back decades. I remember in the Legacy Council, I think it was the Community Safety Partnership, faced exactly this. When you don't have a multi-year budget, you cannot offer a continuity of employment to folk who are producing and working within programs there. And if you haven't got that continuity of staff within particular areas, you haven't got a continuity of planned programming, which is the ultimate purpose. So the issue of a multi-year budget, it's one which is affecting all levels of government, whether it be local, regional or whatever. And it's something that has to be addressed going forward. And I agree totally with the speakers on that particular subject. And also the reversal of the 70-30 ratio for community and voluntary groups was a disastrous thing to do, to switch for the capital and revenue there. Totally cannot understand why that was done, because at the end of the day, it's the revenue that keeps the programs going. Thank you.
Thank you, Alderman Hussey. And no further indicated speakers on that item. So we'll move on to agenda item 11, and that's the Strategic Service Level Agreements 26-27 with Foyle Search and Rescue, Newton Stewart Leisure Complex Limited and Developing Healthy Communities. And that's Barry.
Thanks, Chair. Members, is to seek your approval to award the 3 SLAs to the listed organisations. You'd see in the section 3 funding for the 26-27 financial year, they're within rates. Foyle Search and Rescue 15,000, Newton Stewart Leisure Complex 37,500, and Developing Healthy Communities 26-27 is included in the rates, and with DFC Community Support Programme. A letter of offer, members, will be issued to all 3 groups for the financial year upon confirmation of the letter of offer from DFC in line with the funding allocations and based on previous discussions from members. And members will also recall during the 25-26 financial year, an additional one-off contribution of 13,800 was awarded the Newton Stewart Leisure Complex. The SLA contribution from Council for this financial year within rates is reverting back to £37,500. So in terms of the recommendation, members, that members note the contents of the report and approve the SLAs for the following lead organisations: Foyle Search and Rescue 15,000, Newton Stewart Leisure Complex 37,500, and Developing Healthy Communities 15,000. Thanks, Chair.
Thank you, Barry. Councillor Duffy, or Councillor O'Farrell.
Happy to endorse that, Barry. Thank you very much.
Thank you, Councillor O'Farrell. We will move on. Agenda item 12, which is the Animal Welfare Service Update, Judicial Review Outcome, and that's Seamus.
Thank you, Chair. Members, the report outlines the Animal Welfare Service Delivery Model and also includes details on service demands over the last 12 months. The level of funding previously provided to councils by DAERA is outlined between 2012 and 2023. And attached to the committee paper is the judicial review judgment, which concluded that the Minister should have informed the relevant Assembly Committee of the decision to withdraw funding. So members recommend that you note the content of the report and approve the current budget allocation, which is 120,000, to deliver the service subject to outcome of the Assembly decision on future funding. Thank you, Chair.
Thank you, Seamus. Any indicated speakers on this item? Councillor Duffy.
Yeah, could I just ask a question, Seamus? So the judicial review has indicated that the minister should have informed, not should have paid. Is that correct? Or is that now a decision for the executive to make?
Through you, Chair, what we're hoping is that the Minister will bring this issue back into the ERA committee, where members of that committee can decide whether funding will be allocated to councils going forward, and we await that decision.
What we're looking at today is approval for us to pay to provide that service until such time as that decision is made.
That's correct.
Happy to endorse.
Thank you, Seamus. Thank you, Councillor Duffy. Nobody online. We'll move on to agenda item 13, and that's the Health and Community Directorate Annual Service Delivery Plan 26-27, and that's Karen.
So members, we have presented the plan just for your review, consideration and comment. We're one of the very busy committees, I think, of council. So whilst we're working hard, members are also. We have had 17 deputations this year, with a further 8 in the offing before the annual general meeting. So you're going to continue to probably be equally busy and maybe have a couple of special meetings here and there. So it's easy probably for ourselves as a director to point out the very sort of showcase activities that we do in terms of, you know, capital development, in terms of our administration of funding. You see regular reports and reviews of all of that coming through the service. There's also, I suppose, the backbone of our services, and particularly in terms of environmental health, with, you know, 3,800 plus service requests actually responded to and addressed, or whatever. You know, our buildings are there, they're staffed, they're manned, hopefully they're clean whenever we get to them as such. But I suppose the general drift, particularly with the direction of committee, has been to look at sort of that wider public health piece, the intervention piece, and those are things that you will hopefully see actively highlighted in the plan. So we've mentioned already this evening the SCIG Health Impact Study. We're engaging with the Trust around an early frailty programme for over 50s. We're in partnership with the university around looking at reducing health inequalities through family participation and exercise through a research process. We've just launched our Walking for All. We're involved in healthier weight. So the remit is growing. I suppose the biggest accolade, and probably with my chair here beside me, is obviously the UNICEF accreditation this year, which was a tremendous output for a team right across council. So members will continue to address the opportunities that exist for funding and to sort of drive forward service delivery. So happy to take your comments. Thank you.
Thank you very much, Karen. And just from a personal point of view and as chair, I would like to say a massive thank you to the whole team. I suppose being chair opened my eyes in relation to how wide the Health and Communities Committee and the Directorate actually stretches across our city and district, and how many elements of health and well-being that it does take in. So personally for me, I want to say a huge thank you. The report is excellent, and you've highlighted some of the stuff that we have been doing as a team. And I suppose as well how proactive we've actually been around the ending violence against women and girls piece is to be commended. We've been working hard in relation to the women's health strategy. So it's just to say a massive well done, and a thank you from my point of view as well. It's an absolute pleasure to chair this committee. So Sandra, you wanted to come in as well?
Yeah, thank you, Chair, and thank you, Karen. And I just endorse what you've already said, Chair, in terms of the work of this committee. I've been on council quite a long time now, and I have sat on all the committees apart from planning, and could we keep it that way? And health and communities is definitely one of the committees that I enjoy, because you have such a breadth of work that is going on, and it is all very relevant to the work that we do on the ground day in, day out in our communities. I think that some of the work that we do, you know, you have highlighted some of the main ones there. The UNICEF accolade, absolutely, it goes without saying that has been a highlight for the entire council, and well done to everybody who worked on it. but there's also smaller issues that are being worked on. And Seamus, I'll speak to yourself in terms of the health inequalities and homelessness work that is going on quietly in the background as well, because there is a lot of work that is going into that. There's a lot of issues around vulnerability that we as a council are stepping in to meet needs that probably are beyond the remit of council at times. But because we see the needs on the ground, we want to get involved and we want to get that work done. And in terms of, you know, we talk about cradle to the grave type of services, and we've seen the breastfeeding stuff that has been brought forward and the work that the committee has done around that. I just think that this committee, such a breadth of work that's going on, and Barry, I can't leave yourself out in terms of, because I know I torture you a lot around some of the community sector stuff, and particularly around our facilities within the community and pitches and all the rest of it, stuff that causes some contention at times, but also a lot of joy to committees or to communities when we get the stuff right on the ground. So well done to everybody who has been involved, and it's great to see the plan ahead and know the amount of work that's gone into it. So thank you very much and well done.
Thank you, Councillor. Councillor Tierney.
Thank you, Chair, and thank you to Karen for the report. I suppose in similar vein to Councillor Duffy, I've been on council quite a while too, sat in all the committees, including planning. Was very quick getting off it, and I don't intend to go back on it again. But I think, and Karen's touched on it, and Chair, you've indeed touched on it as well. It's a very busy committee. It's no surprise that we're still have 8 deputations waiting to get in before the AGM. I think that shows the span of work that this committee looks after. There's definitely, for me anyway, this is probably one of the most interesting committees because it's the work that goes on in communities that actually, in my opinion, and I'm not saying that the other committees don't, but ones that actually make a difference to communities and the estates and people engaging directly with council, I believe is done best through this committee and the staff within it. So well done on that. And Karen, when you were finishing there, you said that we will continue to seek out funding opportunities where possible. I believe that the Grassroots Northern Ireland Football Fund closed yesterday, I think. Can we update on that and where we are at with it? What the decision was, whether council were or were not going to put in an application, or just an update on it. I know there was a information session for clubs and stuff, but we haven't had an update since, so I would appreciate that. But well done on all the work, and hopefully it continues for a long time to come.
Through yourself, Chair, that the application deadline closed for the clubs, not the council application. So we have engaged a consultant team that have been involved in the previous Northern Ireland Football Fund, and we're looking at a number of sites, and again trying to look at the criteria and what is more realistic. We have 4 or 5 sites that we're looking at present, and we're still, that process is still ongoing. We've a couple of weeks, in terms of finalising that, and we'll be able to give an update, further update at council around that.
A further update at full council
on the sites and decision, around this. We're still scoping that out and working with the partner around this in terms of looking at what would meet the criteria and what's possibly achievable.
Yeah, and will there be an update? Sorry, Chair. Will there be an update on the decision-making process of how whatever site was deemed?
Well, yeah.
Yep, that's fine. Thank you. Okay.
You're welcome. Online, Alderman Kerrigan, please.
Thank you very much, Chair, for allowing me in. And again, I'm not a member of committee, but as other speakers have said, I've served on every committee apart from business and culture. I did spend 2 years in health and community and the last term. And although you may not have the largest budget out of the committees, because I know there's another committee that's precious in that one. Definitely, it was always the longest committee meeting out of any of the ones I always found, and there was always a massive amount of business. And even looking through the agenda that's on for today, there's a lot of items on it, and I don't want to hold you back, Chair. But no, the amount of work that's undertaken throughout the Health and Community Directorate, it's a credit to you, and I know there's always asks, and there's always greater asks, particularly from elected representatives, but again, it is a well done. And again, to be fair, you all do good work, and all the officers are approachable no matter what time of the day or night they maybe are getting contact about issues. So it is a thank you for the work. And again, Karen heads it up very well, and I do thank Karen and all the team. And I'll say, I mean, even today, I've had contact then today in regards to environmental health over issues. So there's always ongoing issues, and I know Seamus does a great job there too. For his wee, I'm looking for something off him. So Seamus does a powerful job as well. I'll say that. So no, thank you all very, very much for the work that's undertaken. And I say it's just the level of work and continue. And I say, even as touched on the Councillor Tierney there, you're continuing to seek alternative sources of income as well to try and progress these projects. And I know we're still looking at issues in regards to Newton Stewart and trying to get pitches and all that sorted out. So it's still on the agenda, but it is the work is genuinely appreciated. And just to concur with the previous comments. Thank you very much, Chair.
Thank you, Alderman Kerrigan and Alderman Hussey.
Thank you, Chair. As others have said, I've served on, I couldn't name the committee since 1989 when I first came into local government. And can I say a sincere thanks to Alderman Montgomery, who took over from me in planning. Thank you, Janice. She's there. The scope of the remit of the directorate is obvious, as others have referred to there. And most will know I'm not a member of this particular committee, but I find it necessary in my electoral representational role to ensure that I come along to this committee, and indeed all committees, because the work that is there and is relevant to our areas has to be acknowledged, and we do acknowledge that, and thank all of those involved within the department for the work that they do. There's always more to do, and the department and officers are always up for that and do what they can. They cover what they do cover, but also continue to look for advancement throughout the remit of the directorate, and thanks for that. It's appreciated.
Thank you, Alderman Hussey. And we've no further indicated speakers online either, so we're going to move on to open for information. I'll go through the items and I will endeavour to see hands raised or indications online, because I have to look with my glasses to read it and then see without my glasses. So agenda item 14, good relations, update on delivery of programmes through the additional funding for racial and social unrest. Agenda item 15, the hockey provision. Alderman Hussey.
Thank you, Chair. I'm just noting in there that one of the provisional areas we have is Kesselrick High School, and there's a need to congratulate the school in that they have sought funding and will be upgrading their current 2G pitch. Through some schools program or whatever, but the pitch is being renewed. So congratulations to the school for doing that and providing that hockey provision, not alone for the school, but for Derrick Valley Hockey Club. One of the areas that I note there, we don't have hockey provision in Strabane, and I find that disappointing. And the reason I find it disappointing is when I was at school, not the day or yesterday, Strabane had a tremendous reputation in hockey, particularly men's hockey, developing out of the academy. And it's just a pity that that has disappeared from Strabane. And I presume perhaps some of that has moved. Well, obviously there's the emphasis now on rugby, but perhaps Rafo, Prior and Rafo are where some of the Strabane hockey players maybe move on to. But it's disappointing that that is the case. Quick question, and it's not related directly to hockey, but I noted that Belfast has achieved designation as a European City of Sport Were our officers aware of that particular designation? And I want, did we consider looking into it or not? Thank you.
No, not specifically. I don't think there was a call or an invitation that came to us. My understanding is that Belfast worked with the department in relation to their proposal and their bid.
Thank you for that update, Karen. Agenda item 16, stakeholder engagement, Templemore Strategic Leisure Project. Agenda item 17, an update on dog and animal welfare work activities. And that Alderman Montgomery online.
Oh, thank you, Chair, and thanks for letting me in. I just would welcome it, and also welcome the new scheme, the Green Dog Walker scheme. But I just really wanted to highlight that recently in the Drummahoe Walking Park, we've had another dog attack where a dog that was not on a lead or was not under control of the owner had been attacked. And I'm just wondering, because there's no CCTV around that area, it is difficult to try and find who the dog or the dog owner is for the dog warden to make contact with. Could maybe possibly the dog warden could up maybe his patrols around that area.
Seamus, are you coming on now?
Yeah, just to advise Alderman Montgomery that we will increase patrols in that area, and if there is any evidence that you can provide to the dog control service on this attack, then by all means pass it on. Thank you.
Thank you, Seamus. And Alderman Kerrigan online. Alderman Kerrigan, are you coming in on this item 17? Alderman Hussey.
Yeah, thank you, Chair. I'm looking at the scattergraph of actions recorded, and I'm noting what is it 8 in the dark area out of whatever the overall total is. Obviously, some of those will be patrols, some of them will be reactions. Is there any way of finding out the schedule of dog patrols that would go out to the rural areas, or is it reactive in that when something is reported that then wardens would be on scene?
Through you, Chair, the majority of patrols are proactive, but they do focus on areas of high footfall, villages, towns, hamlets. So in terms of the rural areas, it's probably more reactive in terms of dealing with complaints about attacks on livestock, that type of thing.
Thank you, Chair. And I will say it that, some of the settlements in the rural areas would welcome probably a few more scheduled patrols within the rural settlements there, the major rural settlements within the rural area. Thank you.
Thank you. Councillor Boggs.
Yeah, just a very brief point, and it probably straddles over Ian and ourselves, but on page 379, the paragraph shows dog fouling signage erected 1, dog fouling signage requested location 0. Would that be a request from ourselves as members, or is that people phoning in for those? I know it can be challenging at times when you make a request to be they look at evidence in relation to how much buttons are being used and all the rest to see if there is a need for an additional button or signage or all the rest. So there's more requests being made, I suppose, by members. So is that by members of the public then that we're recording on that, or is it where maybe people ask the dog warden themselves? I just want, just for clarity.
It's probably twofold, either elected members directly, or if we get complaints in a particular area and the wardens find it difficult to gather evidence, then they may decide themselves to either initially install signage and to try and reduce the occurrence of the problems, or if it continues, then cameras will be installed.
Thank you, Seamus. Councillor O'Farrell.
Seamus, just a quick question on the dog wardens. DC in our area, many dog wardens do we have? And I know it's probably a thankless task they're doing, but, and just another thing, how many people have been prosecuted for their dogs fouling or whatever? I just see a very small figure there. People will be disappointed because in the rural areas, and especially I'd say primary schools and stuff like that, and you're aware of it anyway, we have loads of complaints. And now there's loads of dog owners out there, and they're responsible dog owners, but there's other people that their dogs free at night. They're killing sheep and everything else. They're attacking people. But how many? We haven't. I don't think we have enough wardens. How many do we have to cover? It's a vast area they're covering. You know.
Councillor Farrell, we have currently 3 dog wardens, and thankfully this committee and council have approved the recruitment of an additional dog warden, and that's just been advertised, I think, today. So we will have 4 plus management support and admin support. In relation to dog fouling, it's probably the most difficult area of work within that section, largely due to evidence in terms of the way we get reports of dog fouling, but very seldom do we get reports on the owner of the dog or the particular dog itself. So it can be difficult to gather that evidence to either issue a fixed penalty or prosecute, but the wardens continue to do the rest. Thank you, Chair.
Thank you, Seamus. And just to check, is Alderman Kerrigan there? Do you need to come on this item, Keith? He's away now. He's gone. No problem. So item 18, Peace, the Air Project, Partnership for Evidence and Action on Clean Air. Agenda item 19, the Pollution Prevention and Control District Council's Charging Scheme. Item 20, licenses, permits and orders issued under delegated authority. Nope. Item 21, correspondence. Councillor Boggs.
Can I just make a very brief point in relation to the school meals, C6426, and just to welcome the work that has been done by Danny Baker MLA in relation to his holiday hunger private members bill in the Assembly. It received cross-party support all bar one party to proceed to the next stage of the legislative process. And I think that's a really important piece of work that we should all get behind. And I know as a council we have passed motions and written off correspondence in relation to holiday hunger payments and school meals. But that is a vital piece of work to make sure children don't return from the holidays hungry. The point was being made about your children don't learn when they're on holidays, so what do they need payments in relation to providing food for? That actually has been said in the last week, which is absolutely shocking. They need it because children learn all the time. They don't just learn when they're in a classroom. They do more learning sometimes outside of a classroom than they do in it, and that's coming from a former teacher who tried to teach 30 of them at the one time at days. But you know, children coming back, particularly from prolonged periods of holiday, having maybe not been given the proper food or nutrition that they needed when they were away, how can they be expected to be playing at the same level in the field of their peers who have had a different experience over prolonged holidays? So I just want to put that on record and wish Danny all the best as he continues that private members bill through the legislative process, and hope maybe that some of those members or those parties that weren't able to support that progress into the next stage, hopefully some members in this committee and this council could go back and speak to their party leadership and their MLAs of the importance that we know on the ground in communities, how important holiday hunger payments would be for those people and those young people and children that have outlined.
Thank you very much for that, Councillor Boggs. Agenda item 22, consultation list. 23, child's rights. Can I have a proposer and seconder, please, for confidential? Opposed, Councillor Clark, seconded, Councillor Boggs. And James, you can give